Hi, my name is Mr. Rice. I'm from Drake Technical Community College. Today we will be discussing facial and body waxing. Many clients, both female and male, view their excessive or unwanted hair as extremely embarrassing and unattractive. Hair removal for cosmetic reasons is a very popular service. It is estimated that about $4 billion a year is spent on hair removal products and services. It is important for the esthetician to master the skills necessary to perform this service, as well as the communication skills necessary to not embarrass your clients. This service should be performed in such a way that clients feel the least possible amount of pain and discomfort. This chapter provides information and techniques on procedures and techniques currently being used in the salon spa environment. However, new and more advanced techniques and products are being developed every day, and the esthetician should be tuned into these advances. How many of you have ever had any type of hair removal surgery before? Well, I'm willing to bet that all of you have had at least one hair removal process. Some temporary methods are tweezing, shaving, depilatories, threading, and waxing. Now, how many of you have had a hair removal process? Today we are going to discuss the waxing method of hair removal. Keep in mind, this is a temporary process and the hair will always grow back. First, let's define what waxing is and what it means. Please turn to chapter 13, the waxing chapter. Waxing definition. Waxing is a temporary service. Waxing pulls hair out from the follicle. This is why waxing lasts 4 to 6 weeks before new growth is noticed. Waxing is an epilator, which is any product that removes hair from the follicle. We need to remember that. Wax is an epilator, which is any product that removes hair from the follicle. Waxing is a form of semi-permanent hair removal, which removes the hair from the root. New hair will not grow back in the previously waxed area for 4 to 6 weeks again. Although some people will start to see regrowth in only a week due to some other than breakage, almost any of the body can be waxed, including the eyebrows, the face, the pubic area, which is bikini waxing, legs, arms, the back, the abdomen, and the feet. There are many types of waxing suitable for removing unwanted hair. Waxing on sensitive body parts is best performed by an expert such as a licensed esthetician. Most parts of the body can be waxed, including nose and the ear hair. Areas individuals should never wax include your eyelashes and eyelids. These areas can be severely damaged if waxed. You have your hot and cold wax. Wax may be used either hot or cold. For clients who cannot tolerate the hot wax or those with sensitive skin, cold wax may be used instead. Cold wax must be applied thicker and does not require the use of fabric strips to remove from the skin. Instead, the wax is pulled directly from the skin in the opposite direction of the growth. You have your waxing supplies. I have some handouts for you. You can take one and pass the rest down. Your waxing supplies. You have a facial chair. You have your wax remover, your fabric strips, you have your towels, skin cleanser, disposable paper, your wax heater, your headband or hair clip, which is used to protect your client's hair from wax getting in. Your disposable gloves, your emollient or your antiseptic lotion. Waxing preparation steps. You want to sanitize the area, melt the wax in the heater, place disposable sheet on the facial bed, Pre-cut your fabric strips for removal. You always want to arrange your supplies in the order of fashion. Protect your client's hair with headband if necessary. Drape your client. Wash your hands and put on disposable gloves if required. Your waxing steps. Pass these down, please. Do we have any questions so far? Good. You want to cleanse the air to be waxed. You want to apply power to the air to be waxed. You want to test the wax temperature on the inside of your wrist. Make sure it's not too hot for your client. If it's too hot for you, it's too hot for your client. You're going to spread a thin coat of wax in the direction of the hair growth. Again, you want to spread it in the direction of the hair growth, not in the opposite direction. You want to apply the glue strip in the same direction as the hair growth. Press gently 3 to 5 times. Pull the skin taut and quickly remove the strip in the opposite direction. Your waxing steps continue. You want to apply pressure quickly again, and you want to apply a light massage so your client won't feel any pain. You want to repeat this procedure as needed till all the hair is removed. Afterwards, you want to cleanse the area with a mild wax remover if needed. You want to apply antiseptic. Apply a soothing lotion, undrape and show the client the results. Afterwards, you want to have some cleanup steps. You want to make sure you clean up after each wax.
I have a question.
Yes, ma'am.
What is the soothing lotion?
The soothing lotion. The soothing lotion is used afterwards, after the wax treatment is done, so your client will not feel any kind of discomfort. Some clients, they have like a little redness. I refer to those as angry follicles. So it pretty much just calms the redness down.
Okay.
Your cleanup steps. Offer to rebook your client. Discard the unused supplies. Place soiled linen in a closed hamper. You want to clean and disinfect the implements. Sanitize the bed and counter. Wash your hands with an antibacterial soap and warm water. Cautions and suggestions. Do not use excessive wax. It may spread to other hair you do not want to remove. Never leave the wax heater on overnight because it's a fire hazard and can affect the quality of the wax. You want to tweeze any remaining hairs if needed. Be sure the wax is not too hot for sensitive areas. Always give a patch test prior to the use. The contraindications. The main reason for the client consultation is to determine if the client has any contraindications for hair removal. It is also helpful to know if they have been waxed before and if they have had any problems or reactions from past waxing experiences. Contraindications and cautions include you don't want to wax over scar tissues, moles, skin tags, warts, or varicose veins. Do not wax over skin disorders such as psoriasis, keloids, AIDS, chemotherapy, blood thinners, epilepsy, and diabetics, recent microdermabrasion or injectables, which is Botox or other dermal fillers, recent chemical exfoliation using glycolic, salicylic, or other acid-based products. I had this client came to me about a month ago. She had just left the dermatologist's office and she had a Botox injection. Before I waxed her, I noticed both her brow was jumping just a little bit. If you have a client that comes in, they just had a Botox injection, to make sure they get a doctor's order before you can perform a service on it. They may get upset at you, but that's going to cover you and your salon spa. Here's an intake form, a sample. You take this and pass it down. Remember, always get your client to fill out an intake form before you do a service on it. Again, before any service, a consultation is always necessary. The client assessment form should be completed by each new client and kept in the client's folder. So benefits and drawbacks. There are many benefits to waxing versus other forms of hair removal. It is an effective method to remove large amounts of hair at one time. It is a long-lasting method. Hair is waxed. Hairs will not grow back for 2 to 8 weeks. When the hair is shaved or removed by depilatory cream, the hair is removed at the surface rather than the root. Within a few days, the hair can be seen at the surface. With these methods, hair tends to grow back in a rough stubble. Areas that are repeatedly waxed over long periods of time often exhibit regrowth that is softer. There are many drawbacks of waxing as well. Waxing can be painful when the strip is removed from the skin. Although the pain is not long-lasting, it can be intense, particularly in the sensitive areas. Another drawback to waxing is the expense. Waxing is usually performed by a licensed esthetician, and in some cases, the cost can be very high. Depending on the area of wax and the number of sittings required, there are do-it-yourself waxing supplies, but they may be difficult to use on some areas of the body. Another drawback of waxing is some people experience ingrown hairs, red bumps, and mild bleeding. This is more likely to occur when waxing areas with thick hair, especially the first few times the follicles are strongest. Any questions so far? Okay. Okay. Hair removal is a major service offered in the salon. The esthetician must have a thorough knowledge of the histology of the hair, the skin, and its properties to offer these services with confidence and profit. It is also extremely important for the esthetician to follow all sanitary guidelines in the removal of unwanted hair. It is important to practice basic waxing techniques until you are comfortable with them, and then adjust your techniques based on the needs and skin types of your client. Okay, that concludes our session. We're going to go to the lab, and I'm going to do a demonstration, and then I'm going to let you guys practice on yourself also. Thanks.